what's your name?
Gracie Gean, Bagosy-Young.
That's a pretty name.
I just got married.
Yeah. Congratulations.
Thank you.
Where are we today?
The Neuroscience Center in Deerfield, Illinois.
Yeah. And what treatment are we discussing today?
Well, there's actually a lot of different kinds of treatments here. Primarily is the combination therapy, which is the mixture of IV ketamine and transcranial magnetic stimulation. That's the treatment that I went through.
Mm-hmm.
And recently they just added on the hyperbaric oxygen therapy chambers. They also have a few other tricks up their sleeves, which would be the trigger point injections and etanercept injections,
Mm-hmm.
and a few others that Dr. Best would probably have to describe because I'm not a doctor, so not real up on that.
How did you find this clinic?
Well, last year, I actually, with the Power of Pain, I organized the first ever Midwest Pain Summit,
Mm-hmm.
and I hit him up for money. I wanted him to be a sponsor at our pain summit because I knew he had hyperbaric oxygen therapy.
Yeah.
I had no idea that he had this combination therapy. So I came in here asking him to be a sponsor and give us some money. And he casually mentioned that he had this treatment, and I didn't believe him because I didn't think that there was a treatment out there that I hadn't tried,
Mm-hmm.
since I had been through just about everything. And so he explained it to me, and he told me that he could help me, and I didn't believe him. We actually argued back and forth, and when he out-argued me, I challenged him, and I pretty much just said, prove it. So he did. He treated me, and I've never been so happy to be wrong in my entire life.
When did you start treatments?
It was August 20th of last year.
Okay.
August 20th of 2014 was my first. That's when they scanned my brain, and then I started treatment that very day.
Okay. How long did it take to see results?
I felt marked results after my very first treatment. That doesn't mean that I went to zero pain or anything miraculous like that, but I had very, very noticeable decrease in my pain, my allodynia, the color difference, everything, the very first time that I tried it. And I knew that this was different than the other things I had tried. My previous treatment I had been doing for 2 years,
Mm-hmm.
so I was very, very used to the results that I was seeing from that. And I knew that this was different because the relief that I had experienced after just one was really, really dramatic. So while the treatment wasn't fun, I knew that it was something I would definitely be coming back to do more of.
Yeah. You were speaking of other treatments that you've tried. What other treatments other than this have you tried?
I started out with the easy things, like the lidocaine gel, the custom compounded ketamine cream,
Mm-hmm.
PT, OT. They put me on a mountain of different kinds of drugs. The Medrol pack.
Mm-hmm.
And then I went on to the stellate ganglion block, which was really scary and didn't work for me. And then I did a lidocaine infusion, which was also very scary. I refused a spinal cord stimulator. And then I did 2 years worth of Kalmar.
Okay. Compared to those treatments, how do they weigh? You said you had Kalmar. In terms of that, how did this help you versus how that helped you?
Okay. Well, I was really, really happy with Kalmar, and I still help a lot of people go get the Kalmar because it worked very well for me, and I think that it does exactly what it advertises to do, and that's scramble the pain signal.
Mm-hmm.
So I never had a complaint about Kalmar. It scrambled the pain signal very, very effectively for me. The thing it didn't do for me was it didn't relieve my other symptoms, such as the exhaustion and the color change and the allodynia. And when the storm would come through, I would still be completely wiped out for 2 or 3 days. Cuts didn't heal, all of those types of symptoms. This treatment alleviates all of those symptoms for me instead of just pain relief. And that's the huge differentiating factor between the two. So while the Kalmar was tricking and scrambling that pain signal in my brain, this is actually treating the disease as a whole package. And that was a huge, huge difference.
Mm-hmm.
So I think Kalmar is great. I think it's wonderful, and it really helped me for a really, really long time. I still steer people towards it. This is a completely different, it's like apples and oranges. It's a completely different type of treatment, and it's the whole deal. It treats all of the symptoms.
Well, thank you. Why did you decide to become an advocate for this condition? For this treatment, excuse me.
Well, I've been an advocate the whole time I've had this disease. I've been an advocate since day one. When I first learned I had this disease, I was all by myself in this. I didn't know anybody, and I dove into my computer searching for other people just like myself. It was a terrible, terrible, lonely space to be in, and I hated that feeling. And from that moment on, I made a vow to myself that I didn't want anybody else to feel that way, and that I would do everything within my power to be that one hand that would reach out and help other people, at least everybody that was within my power. So I have always been on a journey to help educate and advocate for as many people as possible. And with every treatment that I've tried, I have always taken everybody that I know and everybody that is within my reach on a journey with me.
Mm-hmm.
I have always posted about all of my treatments all over the internet and all over my groups, and everything about me is available in those spaces. So this treatment is no different than any of the other treatments in that respect, that I've taken everybody with me. And obviously, since this is the treatment that's put me in remission, I want to scream it from every mountaintop that I possibly can. I want everybody in the whole world to know. And because it works so well for me, and because I've seen it work for every single RSDer that has come in here, I want everybody to have access to it. And, you know, maybe it isn't going to work for everyone in the world. I don't know. But I want everybody to have the opportunity to try, because I have that much faith in it.
What is it like being in remission compared to how you work?
I feel like I'm on a vacation from my body, and I don't know how long it's going to last, but I am so incredibly thankful for every hour, every minute, every second. Words escape me for how phenomenal that feels. And if I could give a little piece of it to everybody that has RSD, I would. I would share that with everyone, because I think all of us deserve to have that. And if it meant that I would have to have it back, I would do that.
In a heartbeat.
I would. I would, because I would like to share that with everybody so they could experience it.
How long have you had CRPS?
Today is June
27?
It was actually
26, yeah.
It was actually 6 years on June 15th. It's just been 6 years.
And sorry, since we're on this, I'm gonna at least delve into it a little bit. How young were your kids when you got diagnosed?
10 and 16. 10 and 16. 10 and 15 and a half.
They've gotten to see their mom be so brave and so strong.
Well, they've had to do some growing up.
Yeah.
They've washed my hair in the sink. My oldest daughter had to shave my armpit. They had to help me pull my pants up. They obviously had to carry things for me. They've had to cut my food more times than not. They help me cook, open doors, watch me cry. You know, they've had to do some growing up, but they're phenomenal young women, and they probably wouldn't have it any other way.
Yeah, I got the honor of meeting her daughter today, and she is a spitfire, amazing young woman, and
so's the other one.
I look forward to meeting her someday. What attracted you? I know you said you're an engineer, right? You
Electronic engineering technician.
Okay. You were talking earlier about after you got diagnosed, what you did. What did you do after you got diagnosed?
Well, I haven't been able to return to work. I tried once, and I had to beg my doctors, and then I had to beg my employer to let me in. Everybody did so against their better judgment, and I only survived for 3 weeks, and then I was pulled right back out. So I haven't been able to return.
Mm-hmm.
So since then, I've been doing exactly what you're seeing now, and that's seeking other people with the same disease and helping them. And since then, through the power of pain, I've been able to branch out to other neuropathies. And then, of course, when you're dealing with chronic pain, you're also dealing with depression and anxiety and other mental health issues. So my scope has broadened from chronic pain to mental health, but advocacy.
That's your baby.
And
really.
focusing on my own health.
Yes, of course.
But advocacy, yes.
Yeah. When you had the treatment, what were your reservations before starting it?
Okay, well, the treatment is two-pronged. You know, they have the IV ketamine and they have the transcranial magnetic stimulation, and so it's two treatments combined into one. The electronic portion of it, the transcranial magnetic stimulation, I was okay with that. That really didn't intimidate me. But the IV ketamine did. You hear a lot of rumors about ketamine, and I'm very anti-drug to start with. I don't take any narcotics or anything like that. I don't really drink, and I've certainly never done any illegal drugs or anything like that. So I was irrationally terrified of ketamine, and I was scared to have it in my body. So I actually came in here and I watched some people get the treatment with their permission, of course, and I interviewed 4 of them before and after the treatment. I really went overboard with my research, and in the end, my desire to get better was bigger than my fear of the unknown. So, you know, obviously I did, and it wasn't everything I was scared of. It wasn't fun. You know, ketamine treatments are not fun, but we're not here to have fun.
Yeah.
We're here to get better, and you know, RSD isn't fun either. So it was more than worth it, but the ketamine was absolutely my biggest fear. The rumors that you hear floating around social media about it being a horse tranquilizer and all those other crazy things, and you hear all these crazy things about side effects and whatnot. The hype is so huge out there, and to be honest with you, I was part of perpetuating it at one point. The hype is so gigantic that there's a lot to be scared of. But when you sit down and you learn the nuts and bolts of it and how it can benefit you, and you talk to your doctor and you find out how controlled it is, the risks really are not as great as what everybody talks about. And the desire to get better is worth it.
As an advocate, how many RSD CRPS patients have you seen come through here since you started?
Oh, just since I've been here in August, without sitting down and counting, I'm sure that there's been at least maybe 12, which is quite a few, because there's a lot of other patients here that are not CRPS. This place treats chronic pain and mood disorders. So probably around 12 without counting. And I haven't seen anybody not do well here. Most people here are really, really pleased to tell you why they're here too. I used to think it was a don't ask, don't tell type of place because they do treat mood disorders too. Yeah. But everybody here is really pleased to jump up on their soapbox and tell you why they're here because they're all getting better. So it's a neat place to be because there's miracles happening every day.
You talked about your brain scans. Can you describe what that was like for you and how it felt from point A to point B of seeing how much better the brain scans you were getting?
Yeah, the SPECT brain imaging was a really easy process. They injected some radioactive isotopes in my arm, and I waited a little bit, and then I laid on a table, and they took pictures of my head. It was very easy. painless. I went to sleep during mine. And when I first saw my brain imaging, it was a very bittersweet moment because MRIs and CT scans don't see anything in our brains, but the SPECT scan did. And it doesn't see RSD, but it sees the inflammation that chronic pain causes. And it was everywhere inside of my head. My biggest fear was that it wouldn't see anything. And it was everywhere, in every single portion of my brain. And they mapped it out for me. And they showed me exactly, this portion looks like ADD. We know you don't have ADD, but the chronic pain makes it seem like you do and makes it feel like you do. Do you ever experience that? Yeah, I do. And it was an amazing experience. And I say bittersweet because it was very validating, in a sense, because it was the first time anyone anywhere had ever said, look, here it is, right here on paper. Here's proof of your pain. And that felt amazing. And then another part of me was like, gosh, all I did was have surgery and now my brain is all messed up. That really stinks.
Yeah.
So, it was very conflicted feelings, but it was really an eye-opening experience to have my brain mapped out and have somebody explain to me, you have inflammation here, 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 and here, and this is why you're feeling this way. That RSD fog that everybody explains, there's a reason for that. They can explain it all. They showed it to me. It's inflammation in your brain, and it goes away. They can treat that. So after 28 treatments, they scanned my brain again and showed it to me in a comparison chart, and my inflammation had gone down 80%. I mean, I knew I was feeling better, but I didn't really realize I was feeling 80% better. And they showed me, look, isn't this phenomenal? And it is phenomenal. It's just amazing to see what they had done in 28 treatments. Now, I had 36 overall, so it would be really cool to have a third one done to see the end result, but they're quite expensive.
Yeah.
So I didn't. But yeah, it's so validating. It's worth its weight in gold because you can't see those things on traditional scans, but I could finally see it. And I'm a very black and white, nuts and bolts kind of person. I want to see proof. I want to see these things and to have it right in front of me on a piece of paper, so validating.
For a CRPS patient, we walk through the world and nobody can see our pain, and suddenly you're thrown in your face. Oh, there is something here. There's tangible proof, and I can only imagine how that made you feel.
Yeah, I sent it to my insurance company.
That's a good thing. That's a very good thing.
I was like, here we go.
Yeah, suddenly I wish that everybody got that opportunity that you got. Yeah. So thank you for sharing.
Well, and my insurance company covered it 100%. It fell under my lab coverage.
Nice.
So I sent them the proof. Take that. I love that this is so different than everything else I've done because it's just showing it's all RSD, first of all, and it's showing vulnerability that I've never had a chance to express.
It's so frustrating, especially for me, working in the not the public sector, with normal people and working with kids. You can't show weakness. Weakness is this horrible, horrible tragedy. If you show it, then suddenly you're not trustworthy, and nobody's going to trust you with their kids. And why do I want you even around? So it's nice to be able to be with somebody like you and I that have the same condition, and you're suddenly completely comfortable, and you know they won't treat you any differently than you want to be treated, because they've been down this path. They've felt what you feel, and they've had similar fears as to you, and you feel validated in the shared experience that you're walking down the same path and you're holding hands with somebody that gives a darn about you.
Yeah.